Okay.
Damien Bellin is used to doctors. Damien has hepatitis C, a chronic liver disease spread through blood. He got it from his mom. He was 12 when he found out.
It's like a little shadow that's behind you, and you don't know how to tell people.
Hep C is quietly the most widespread infectious disease in the US, affecting more than 2 million people. And because it's easily spread through shared needles, the opioid epidemic means it's getting worse.
How's it going? Good to see you.
I'm going to go over your last labs. But first, how are you doing?
They're good.
Yeah? How's life?
Working hard, slinging those drinks.
So the reason I got to treat and cure you as soon as possible.
Absolutely.
You got to enjoy those drinks as much as possible.
Damien's doctor, Jason Halperin, is an expert in infectious disease. He sees patients 5 times a week at a clinic.
How urgent is the Hep C crisis in this country?
It's incredibly urgent. People die of Hep C more than any other infection that exists in the United States. Let it be HIV, TB, influenza. So it is of urgent need to treat and cure.
When Damien was diagnosed, there was no cure. But in 2014, the pharmaceutical company Gilead released a groundbreaking drug.
It's the one and only cure. That's one pill once a day for 12 weeks.
Only Damien can't get it because he's not sick enough.
So here is the letter, January 22nd, 2019.
Denial notice.
It has many, many pages, but the only thing that really matters is this first sentence: and United Healthcare Community Plan will not pay for the care.
The medication is so expensive, Medicaid has had to ration the pill, treating only people whose livers are already damaged by Hep C. Or he could pay out of pocket, with a price tag of $91,000. It's the Louisiana Health Department, with its strapped state budget, making the decisions on who gets treatment. But Dr. Rebekah, the state secretary of health, thinks the disease can be eliminated entirely, and she's been trying for 3 years to get a better deal.
Here we have a cure for an infectious disease. This should be a solvable problem, but it's not because the drug is too expensive.
So she got creative. She dug up an obscure 1910 law that gives the federal government the right to use any patent as long as it pays the holder a reasonable price.
So you considered taking away the patent from the Hep C makers?
Well, we asked the question. Not surprisingly, the pharmaceutical industry was less than enthusiastic.
Sure.
About this idea. So we said, okay, what else?
This time, Guy would negotiate with pharma, but change the terms. For one set price, she'd get unlimited drugs for people on Medicaid and in prisons.
What we came up with, why don't we spend the current price up to a cap that we pre-negotiate, so that's our subscription price, and then after that price, we get rebated back 100% of our spend.
The pricing scheme worked in Australia in 2015. Since Louisiana suggested the idea, Washington State has also followed suit.
How much did Medicaid spend on the Hep C cure last year?
So last year we spent around $30 million.
$30 million. How many people were you able to treat?
About 300.
But let's say you had the subscription model. How many people could you treat?
Our goal would be 10,000 people next year.
All 3 manufacturers of Hep C drugs responded to the state's request for proposals. She's been in talks with Gilead to settle on a price for the generic version of their drug, Epclusa.
It really wasn't until there was more competition in the market that we were able to get some traction.
What's it like to negotiate with a company like Gilead? What power do you have to really negotiate with them?
Yeah, I mean, we have the power of our state spend on drug pricing, but it really is a David and Goliath, and we are David. Any negotiation, if you can't say no, it's not really truly a negotiation.
The deal should be a win-win. Sales of Hep C meds are down, and this contract would lock in a market for 5 years. Still, the June 1st target date to get an agreement came and went.
The for-profit drug industry is extremely difficult to change because they're for-profit, they have shareholders, and those shareholders want to make money.
you're not offering up enough money? Is that what's happening?
Well, we just don't have it. And what would I say to somebody who says, well, it's just not fair that you're not treating everyone? I would say to them, it would cost me $750 million to treat everyone in Medicaid, and that would take away my K through 12 budget. I mean, what do I do? You tell me.
This week, Dr. Gee and the health department finally broke through with Gilead and reached a deal. It isn't everything Dr. Gee hoped. Louisiana is paying a lot more than they did last year. But starting July 15th, the state will have unlimited access to the cure for 5 years, and a big incentive to treat as many people as they can.
Gilead goes through with the deal. Aren't Gilead the people that created this problem?
Yes, the fault is on the drug companies because they're pricing so high, but mostly I blame policymakers because it's our policies that allow these drugs to be so high. This model is an example of a voluntary agreement, one where a company and a state agree to, without having to regulate it.
We asked Gilead if the company bears any responsibility for making the drug so expensive, and they did not respond to our question.
What does it tell you about the landscape of the negotiation market that even though you have all this support, you still can't fully force the prescription drug companies to play ball?
Yeah, I mean, the rules are stacked against us. The idea is, pharma, why should you care, right? So right now, we give you this money and we get restricted access. Why do you care if we're gonna treat someone who costs you dollars a pill? Why does it matter to you if we're gonna treat someone in Medicaid who's not getting treated? Or if we're gonna treat someone in jail, you'll never make that money.
Yeah.
So what is it to you that we treat them and we save their life?